The heart is like the engine of our body. But just like any engine, it can show signs of wear and tear before a big problem happens. In this video, we'll talk about 7 signs you can actually see on your body that could mean you have a heart problem. We'll also talk about 7 things you might feel that could be warning signs. Finally, we'll give you important tips to keep your heart healthy and avoid serious problems. If you want to protect your health and the health of your loved ones, don't miss this video. Stay with us until the end to get all this important information. Visible signs on your body that could indicate a problem. The human body is a perfect machine, and it often sends us visible signs when something is wrong. These signs are not always easy to spot, but knowing them can make all the difference between identifying a problem in time and suffering serious consequences. First sign, the diagonal earlobe crease. One of the most peculiar signs you might notice on your body is a diagonal crease on your earlobe, known as Frank's sign. This seemingly insignificant crease was linked to blockages in the arteries of the heart by Dr. Sanders Frank back in the 1970s. While not everyone with this crease has heart problems, findings suggest it could be an important indicator, especially in younger people. The crease is caused by the same things that damage arteries, like the buildup of fatty plaque. Although it's not a definite diagnosis, studies show that a significant percentage of people with this sign have cardiovascular problems. If you notice this sign in a younger person, it's worth paying attention to. As with age, it could simply be a sign of skin aging. This small detail in your ear can be a window into the health of your arteries and the condition of your heart. Here's the second warning sign: swollen legs, ankles, and feet. Swollen legs, also known as edema, are another sign you shouldn't ignore. If you notice your ankles and feet swelling at the end of the day, or your shoes feel tight, it could mean your heart isn't pumping properly. This happens because a weak or enlarged heart can lead to fluid buildup in the body, especially in the legs where gravity pulls it down. This kind of swelling is especially noticeable after standing or sitting for a long time and usually gets better when you raise your legs. However, if the swelling doesn't go away, it could be a sign of heart failure or problems with your veins. Pay attention to these changes in your body and talk to your doctor if the swelling persists or causes pain. Our third warning sign: ulcers or wounds that are slow to heal. Ulcers that show up on your legs or feet and take a long time to heal can be a sign of circulation problems. These wounds are often caused by something called arterial insufficiency, which happens when there are blockages in the arteries that supply blood to these areas. These ulcers are not only painful, but they can also be a sign that blood flow is seriously compromised. Usually, these sores appear on the outer part of the legs, heels, or toes, and are more common in people with peripheral artery disease, also known as PAD. If you notice a wound that isn't healing after a few weeks, it's important to see a doctor. This could be a sign of a bigger problem affecting not just your legs, but also your heart. Our fourth warning sign: hair loss on your legs. Hair loss on your legs is a lesser-known sign, but it can tell us a lot. Hair follicles need nutrients and oxygen to grow, and when the arteries that supply them are blocked, hair starts to fall out, especially on your calves. This is linked to something called window shopper's disease, which can be a sign of problems in other arteries in your body, including those that supply your heart. If you notice that the skin on your legs is shinier or that your toenails are growing slower, it might be another sign that something's not quite right. While hair loss can be caused by genetics or other conditions, it's crucial to take it seriously and see a doctor if it comes with other symptoms like cold skin or sores. Our fifth sign: yellow spots on your eyelids, also known as xanthelasmas. Xanthelasmas are small yellowish deposits on the eyelids which often indicate high cholesterol. Although these spots are harmless cosmetically, they can be a major wake-up call that something is wrong with your heart. People with xanthelasmas have a higher risk of developing heart disease, heart attacks, and even strokes. If you notice these spots on your eyelids, it is advisable to have a blood test to check your cholesterol and triglyceride levels. Keeping these levels in check is essential to avoid serious complications. Although only a small percentage of people with high cholesterol develop xanthelasmas, their appearance should motivate you to take even better care of your health. Sixth sign: a ring around the cornea, also known as arcus senilis. A white or grayish ring around the cornea, called arcus senilis or gerontoxin, is common in older people, but it can be a warning sign if it appears before the age of 45. This ring is caused by cholesterol deposits at the edges of the cornea and can be due to extremely high levels of cholesterol or triglycerides. In older people, arcus senilis is generally an age-related change and does not pose an immediate risk. However, in younger people, its appearance suggests a more serious condition that may require immediate medical attention. It's another reminder of how our eyesight can reflect the health of our heart. Sign number 7. Blue or purple skin, known as cyanosis. Cyanosis appears as a bluish or purplish color of the skin, and it's a clear sign that something's wrong with how your body is getting oxygen. This can happen because of problems with your heart or lungs that prevent oxygen from reaching your body's tissues effectively. If you see this change in your lips, nails, or fingertips, especially if you're not cold, it's important to see a doctor. Cyanosis can be a sign of several conditions, from blocked arteries to heart failure. In serious cases, it can even be a sign of congenital heart disease. It's a strong visual signal that shouldn't be ignored. The symptoms you might feel. Now that we've talked about the visible signs, let's focus on the symptoms you might experience. These are internal signals that your heart might not be well, and they deserve your full attention. First sign, shortness of breath, also known as dyspnea. Feeling out of breath, especially during everyday activities or even at rest, is one of the most common symptoms of heart problems. This feeling of suffocation, medically called dyspnea, can happen when the heart isn't pumping enough blood to meet the body's oxygen needs. It's an especially important warning sign in people who also feel excessively tired when they exert themselves. Shortness of breath can come on gradually or suddenly, and in severe cases, even at rest. If you notice this symptom along with swollen ankles or extreme tiredness, it's crucial to see your doctor as soon as possible. Don't ignore this cry for help from your body. Symptom number 2, a persistent cough with white or pink phlegm. A cough that doesn't seem to go away, especially if accompanied by white or pink phlegm, could be a sign of heart failure. This happens because the heart can't pump blood effectively, causing fluid to build up in the lungs. Although this symptom can also be attributed to respiratory problems such as infections, its persistence could indicate a more serious problem. If you have this type of cough, especially if it gets worse when you're lying down, consult a specialist. Ignoring this symptom could delay the diagnosis and timely treatment of a heart problem. Our third symptom, difficulty breathing while lying down. Difficulty breathing while lying down is another symptom you shouldn't ignore. Many people who experience this start using several pillows to raise their head and chest, or even choose to sleep sitting up. This condition, known as orthopnea, is a classic sign of heart failure. Additionally, some people may wake up suddenly during the night with a feeling of suffocation, which is called paroxysmal nocturnal dyspnea. If you have this problem, it's important to see a doctor because it could be a sign that your heart isn't pumping properly. Symptom number 4, constant weakness and fatigue. Feeling constantly weak or tired even after resting is another common symptom of heart problems. This fatigue happens because the heart isn't pumping enough blood to meet the needs of your muscles and tissues. As a result, even simple activities like climbing stairs, carrying groceries, or taking a walk can become extremely tiring. Constant weakness can have many causes, but if it's accompanied by other heart-related symptoms, it's important to see a doctor to rule out any serious problems. Fifth symptom, waking up frequently to urinate, also known as nocturia. Waking up several times during the night to urinate can be a sign of heart failure. This happens because when we lie down, the fluid that builds up in our legs and feet during the day returns to the bloodstream, and the kidneys have to work harder to remove it. Although nocturia can have many causes, if it occurs along with swollen legs or difficulty breathing, it is necessary to consult your doctor as it could be related to your heart. Symptom number 6, calf pain when walking. Calf pain when walking, also known as intermittent claudication, is another symptom that could point to heart problems. This pain happens because the arteries in the legs can't supply enough blood to the muscles during physical activity. The tricky thing about this symptom is that it goes away with rest, which makes it easy to ignore. If you notice that you feel pain when you walk short distances and need to stop for the pain to go away, it's important to see a doctor. This could be a sign of peripheral artery disease, which is often linked to more serious heart problems. Symptom number 7, chest pain. Chest pain is perhaps the most well-known symptom of heart problems, and for good reason. This pain, which can feel like pressure, heaviness, tightness, or a burning sensation, is a classic sign that the heart isn't getting enough oxygen. It can spread to the left arm, neck, jaw, or back, and in some cases it can be accompanied by sweating, nausea, or dizziness. If you experience this type of pain, don't ignore it, thinking it's something insignificant like heartburn. Seek immediate medical attention to rule out a serious heart problem, like a heart attack. Tips to prevent heart problems. It's better to be safe than sorry, especially when it comes to our heart health. Here are some practical tips on how to take care of your heart health and reduce the risk of serious problems. First up, stay physically active. Regular exercise like walking, swimming, or cycling strengthens your heart and improves blood circulation. Second, quit smoking. Smoking is one of the worst enemies of your heart health, as it damages your arteries and increases the risk of heart attacks and strokes. Third, pay attention to your diet. A diet rich in fruits, vegetables, whole grains, and low in saturated fats is essential for maintaining healthy cholesterol levels. Also, watch your weight, as being overweight can increase blood pressure and put extra strain on your heart. Last, but not least, get regular medical checkups. If you have a family history of heart disease, it's crucial to see a doctor to monitor your health and prevent complications early on. Remember, your heart is your engine, and taking care of it is the best investment for your quality of life.